It's the most.
Hello, hello.
Hello.
Happy Friday.
Hi, everyone. Welcome back.
Hey, hey, hey. We're going to allow a few more minutes for others to join, but if you're here, grab yourself something to drink and get cozy.
Get cozy with Mom Cozy. There
Get
you go.
cozy with Mom Cozy. Cozy up.
That's fun.
And also give yourself some shine for showing up today. And I
I
see
see someone said
beauty.
hello. Yeah, I would love to know, and I know you would as well. Like, where are you all tuning in from? That's always fun to know.
And tell us where you are in your pregnancy or how old is your baby? Good morning and happy Friday from Denver,
Oh,
Colorado.
amazing. New York.
Rochester, New York.
Yeah.
Oh, sweetie, two
Oh,
weeks old, six
Oklahoma.
months.
Oklahoma, Massachusetts. Oh, now it goes fast.
Sacramento, Nashville,
Dallas.
Dallas.
Cool. I just got off the phone with a mom in Nashville. We were doing a breastfeeding chat. Very cool. Michigan, New Jersey. Cool.
We have some babies
Wow.
coming in fall.
Wow, I love it. It's so fun to see. Amazing. And well
Thank you
done,
guys for
everyone, being
joining
here on a
us.
Friday. It's incredible. The Philippines, that's very cool. That's very cool.
And speaking of introductions, want to send some special shine to Emily from NAPS. Thank you for joining us, Emily.
So happy to be back.
We're happy to have you.
We have a lot of fun stuff to cover today.
Yes. What time is it? It's
One.
1:02.
Oh, you want to dive in? I'm ready when you're ready.
Absolutely,
All
absolutely.
right.
We're incredibly
Welcome.
grateful to have you here with us today as we continue to celebrate National Breastfeeding Month. Today's topic is going to be, it's literally right on time, navigating pumping. So as you settle in with your new baby, of course, a lot of questions will arise. What pump do you use? There's so many different pump options out there. So
Mhm.
have no fear. This session today will be covering the different breast pumps and the different options so you feel comfortable navigating this new space with your new baby. I have a few housekeeping items. Let's try to keep all of the questions in the chat. Um, and that way we're able to get to the chat and see everything in the chat. And so let's stay away from the Q&A and let's keep everything in the chat. Emily will try to get all of the questions answered. I'll answer what I can, and we'll go from there. This
Yeah.
webinar is being recorded, and so a week from today, you will receive the recording. And also, the last thing, and this is a really important one, we do have a giveaway today. Three lucky moms will receive the giveaway. If you hear your name called, it's selected at random. If you hear your name called, say here in the chat, and then I'll give you instructions to email a site so I get your information and get you your favorite gift. Your the best gift ever, actually. Oh, you have it up. Momcozy Mobile Flow
Yeah.
Hands-Free Pump M9. So you don't want to miss this, but you do have to stay until the end of the call.
I actually have it with me too because I'm going to use it for some teaching today when we talk about pumping and flange sizing. But this is actually truly, I'm not just saying this is one of my favorite hands-free pumps in terms of strength and efficiency. So if you don't win it, I see you've also offered a discount code, which is
Fingers crossed, fingers crossed.
very nice of you.
Emily, can you go back
Yes,
one
I can.
slide? I kind of skipped really quick.
That's
No,
okay.
the
It's an
next one.
exciting giveaway to get to.
Yeah, it is. The Mom Cozy. I think it's the one just before that.
Oh, sure. Oh, it won't let me.
Well,
Sorry.
while we're working out, hey everybody, I'm Sonia from Mom Cozy. We are a maternity and baby brand, started as a nursing bra company back in 2018, now serving over 4 million moms in 60 countries with more than 200 thoughtfully designed products for mom and baby. So welcome, welcome, welcome. And join our Facebook community. Come on in. All you have to do is scan the QR code, and this is a great safe space for moms to connect, find your village, get questions answered, offer peer-to-peer support. Come on over and join us. And we already talked about the giveaway, but just make sure that you stay until the end of the call to qualify for the giveaway. And with that, I'm handing it over to Emily.
Here we go. So my hope is, I know that there's going to be so many questions coming through the chat. Feel free to keep using it. My hope is that as I teach this course, a lot of the questions that I know you're going to ask are built into the content. So follow along. And then at the end, I'll also answer questions live. Before we get started, I'm sure, and there's almost 300 of you here. That's amazing. I'm sure some
Amazing.
of you maybe were here last week and some of you weren't. That's totally okay. But just introduce myself in case we're meeting for the first time. My name is Emily Silver. I am one of the co-founders of NAPS. I'll tell you a bit more about NAPS, but my background is I was a labor and delivery nurse for a good amount of my career before becoming a nurse practitioner. And as a nurse practitioner, I worked in the OBGYN space and then went on to take care of women who are pregnant and postpartum through my company NAPS. I'm also an IBCLC, which is a board certified lactation consultant. And I think what's most important to know about me is that I'm also a mom. I have 3 girls. They are now 10, 8, and 3. And so I talk a lot about my own feeding journeys, truly. In fact, if you use social media, our Instagram is Nurture by Naps. And just yesterday, I posted for World Breastfeeding Week a story about my 3 very different feeding journeys, if you like to read about that. NAPS is a company that provides support and education to parents throughout pregnancy, postpartum, and into the toddler years. And what we are known for is that everybody on our team is a medical professional, an RN or an NP, or some kind of doctor of occupational therapy or mental health. Everyone's in one place, and we hope to provide you, or I know that we provide you, a safe place to come and ask questions, navigate options, learn more about what do we know through research, what do we not know, what are my options, and how do I make decisions for my family that feel good for me. So we're always going to come at you with medical information and that real life parenting advice that is judgment free. And so today we're going to talk about pumping, just the basics of getting started with pumping, how and when would you pump, like what are some things that you need to know. I'd love to know in the chat too, if you're expecting a baby, do you have your pump yet? Are you navigating the pumping space? And then if your baby is here, where are you at in that journey? Is it sitting in the box? Are you wondering how to use it? Are you wondering when to get started? I hope to answer a lot of those questions throughout this presentation. So, everyone always asks me, Emily, when should I start pumping? And honestly, pumping is going to start for you um, based on your situation, right? So sometimes that's when it makes sense for you. And then the right time may depend on a specific situation that's going on with you and your baby. So let's do a few examples. Let's say you are planning on breastfeeding and you're thinking, I'm going to leave that pump in the box and I'll figure it out later, or I'm going to pump later. There are reasons why you may need to pump sooner than planned. So for example, maybe your full milk supply isn't in yet, or your baby hasn't regained their birth weight, or they're having trouble with feeds and your pediatrician says to you, your baby needs additional calories, right? I talked to a mom this morning whose pediatrician said, you need to supplement your baby. And the mom called me and said, what does that mean? They didn't explain what that means. And I said, okay, we're breastfeeding, but your baby isn't getting enough to gain weight. So supplementing is giving breast milk or formula to help them gain weight. But mama, I need to get you pumping, because if breastfeeding is your goal and your long-term plan, we want to make sure that we're driving in your milk supply and increasing it. So then I may say to a mom early on, we're going to pump sooner than you thought because we want to tell your body to make more milk so that you can ultimately breastfeed. Okay. Or another scenario is that maybe you're home, breastfeeding's going well, and you're thinking, I'm going back to work soon. I know not everyone here is in the United States, but a lot of the moms that I work with here in the United States are returning to work around 12 weeks postpartum. And so they may be thinking about pumping early on to build a milk supply stash for when they go back to work, to have milk for their childcare provider when they're back at work. Or they may just want to pump when they're postpartum so that their partner can share in the responsibility and give the baby a bottle at bedtime or overnight. And then I want to acknowledge my moms out there that have chosen to not breastfeed. I work with many women who say, you know what, I want to give my baby breast milk, but breastfeeding isn't for me. It's not working out. I'm going to exclusively pump. and they choose to exclusively pump and give bottles of breast milk. I work with tons of moms who are combo feeding. They might be breastfeeding, bottle feeding, pumping, and mixing in some formula. And then I work with women who are weaning. So everybody's journey is going to look different, and we need to obviously make a plan that's best for you. I want to back up and just talk through reasons of why we would supplement, because I do feel like if you are newly postpartum or you're about to have a baby, a lot of parents are wondering why, why would that happen? Why would I have to supplement or give bottles of breast milk or formula early on? And so when you're right out of the gates and they maybe advise this for you and what's best for you and the baby at the time, that could happen. Maybe I have a mom who's just physically not well, a very long labor or a C-section, and she's recovering and she's struggling with breastfeeding or isn't able to breastfeed. I say mentally unwell. Like I work with a lot of women who are struggling with postpartum depression, postpartum anxiety. So they might not be able to breastfeed or pump as much as they wanted to right away as they're recovering. Or a baby that's born prematurely. So maybe your baby is born before 37 weeks and they're spending time in the NICU and they're working on breathing before they can start to work on eating. So those NICU nurses have you pumping and working on feeding. Sometimes my moms that I work with have gestational diabetes. And when their baby is born, the baby has low blood sugar because of that. So we might need to supplement or give extra liquid ounces to help that baby get their blood sugar up. Um, Weight loss. I feel like that does come up often with moms that I'm working with. So, and we talked about this a little bit last week when we talked about establishing breast milk and your breast milk coming in, but all babies lose weight, right? They're born and we weigh them and they're a certain weight. And then before you go home and you're discharged, they've lost a little bit of weight. We expect that. That's actually normal. And babies have 2 weeks to regain their birth weight. So, but if a baby loses 10 to 12% of their birth weight right out of the gates before you go home from the hospital or at that first pediatrician visit, based on where you live, here in Boston, and most pediatricians follow 10 to 12% of birth weight. They may say to you, your baby's now lost a little bit too much weight, so we want to supplement. And that's where lactation comes in, where I would encourage you to work with NAPs or find a lactation consultant in your community, because if your goal is to breastfeed and or pump, we want to make sure that your baby's getting calories to regain their birth weight and that we're making a breastfeeding and pumping plan to help you get to where you wanted to be for your feeding goals. Talk about a delay in milk coming in. It's not uncommon that I walk in the door. I see people in the home as well as telehealth. I may walk in and I show up in my scrubs with my scale, and that mom is breastfeeding and putting the baby to breast and maybe pumping, and they're having a delay in their full milk supply arrive in. Sometimes I see that if there was a lot of bleeding at delivery, a postpartum hemorrhage, or if the mom has a thyroid condition that can impact milk supply coming in. So right away from a medical standpoint, I'm like trying to figure out why, like what can we do? Like why is the milk not in yet? And then we may put that mom on a plan where they are breastfeeding, pumping, and bottle feeding. Breastfeeding to get good at it, pumping to make sure we drive that milk supply up, supplementing with a bottle to make sure the baby's getting enough calories. And that's a pretty specific plan, but it's called triple feeding. I believe that came up last week as well. And I'm sure some of you have heard of it or might be actively triple feeding right now, like as we speak. Let's talk through the basics of using a pump. Okay. So there's a lot of pumps out there on the market. And I think like a good place to start is let's just break down the different pumps that you'll see. So one, we have silicone pumps. Silicone, like a Haka, ladybugs, troves, they're silicone, and what they're milk collectors. And what those do is when you apply them to your breast, they apply like a very gentle suction and they're able to just collect milk like a letdown. We have manual pumps. That would be that you put something right up to your breast and you literally use your hand and you manually pump. Okay. Some women like to have those on their nightstand for overnight or in their purse when they're driving around doing errands in case they need to let some milk out. We have electric pumps. Those are your pumps that are going to plug in and charge up, and they may always need to be plugged in when you use them, or maybe you can plug them in and charge them up and carry them around. And then we have our hands-free pumps, which also do need to be charged. I'm going to get mine out now. So I'm going to use the Momcozy one as the example. These are your wireless pumps. So you're going to plug them in and you're going to charge them up. You can have two of them. I have two here. And these are your hands-free pumps, okay? So they're going to go into your bra, hands are free, and you're walking around. So there are different kinds of pumps. As you navigate what you should get, I would be thinking about how often are you pumping? Why do you need the pump? Is it because you have low supply and we're trying to drive your milk in? Is it because you're back at work and you have a really busy job and you're pumping throughout the day? I feel like there's different occasions for why my brain advises you on what pump to get. When it comes to the hands-free pumps, I do think that these are very helpful for my moms who are exclusively pumping, like that's all you're doing, or for once you're back at work, if you're working like a really full work day and it's hard to stop throughout the day to pump. So at the end of the day, though, when we're thinking about pumps, the basic things that you need to be looking at: power source, how do you charge it? How do you plug it in? Tubing, okay, so some of these electric pumps have tubings. Flanges, which I'm going to get to, like sizing your actual flange, the valves, the bits, the pieces. So let me get some other props out from behind me here. If you're using an electric pump and it comes with tubing, your tubing is going to connect to your pump, okay? And this is just for suction and for air. So when it comes to your actual pump, you can wipe it down on the outside. Tubing you can keep clean and dry. You don't need to wash, steam, or boil this. This is just for suction. And then all of your other bits and pieces that come with your pump, those you can take apart and you can wash and you can clean them. And so pull things apart. Your bottle pieces, they'll come with things where you can collect milk into the bottle when you're pumping. And then you're going to have your flange. And that's the inside of the pump where your nipple's going to pull through. So we're going to talk about sizing that. No matter what pump you get, I would look through your insurance to see what's covered. You can talk to a lactation nurse. I'll give you a link at the end where we can actually help look at your pumps and help you pick it. And then more importantly, we want to make sure that you're sized appropriately for it. So let's talk about that next. Now, I'm going to use a different flange other than the Momcozy one really quick to show you about sizing just because it's clear. And then I'm going to show you some really cool other little pieces as you think about sizing your pump flange here. Um, when you are pumping, when we're picking out a pump for you, it will come with flanges and bits and pieces in size. So for example, what I actually love about Momcozy is they give you multiple different cushions, flanges, because one size doesn't fit all, so that you can figure out what is going to fit you best so that you can insert it into the pump as a cushion to make sure that it's fitting your nipple appropriately. Okay, not all pumps come with that. So when you're looking at basic electric pumps on the market, they usually send you two sizes for a flange. And how do you know the size? You look right on the side of it, okay? Or the packaging is going to tell you on the side of the packaging. Here's my Momcozy one. This says 17 millimeters on the side. Okay, so what does this all mean? When we're getting, and we talked about getting a deep latch last week with the baby, going up and over the breast, having a big mouthful of breast and pulling that nipple under. When we're pumping, it's creating a suction to release the milk from your breast. And so when you're pumping, your nipple is going to pull into the tunnel of the flange. All right. Now, when it's pulling in, we don't want the nipple getting stuck or rubbing, okay, or chafing. That could cause damage. And we also don't want to see areola or breast tissue pulling through the pump. Then that would be too big. Now, a common thing that I find when I'm helping women pump, if they're just not making enough milk or they're feeling like my supply is low or I have pain with pumping, we talked about this last week, pain is common, but it's not normal. Then I'm thinking we need to check the sizing on your flange. Pumping should feel comfortable. It's a pressure, it's a tugging, but if we are off on size, if it's too small or too big, that can impact your milk supply. So we're basically looking at all these flanges and bits and pieces to figure out what fits you best. Now you can measure your nipple. So Momcozy is a great tool. You can grab it on their website or on Amazon. It's like a ruler And when you measure your nipple, you're going to stand over and you're going to put it to your nipple and you're going to see what size fits your nipple and the base of your nipple best. We don't want to see areola. We don't want to see breast tissue. We want the nipple to fit nicely into the hole. Okay. When you find your size, then we're going to match you to your cushions that are going to go into your flange or the plastic flange that your pump came with, right? So if I measure my nipple and it measures at a 20 millimeter, my flange size is probably going to be a 24. All right. So it's a little tricky, right? So you need to get your number on the tool and then we're going to see how it matches up. So if you measure smaller, and you have smaller nipples, all right, we're gonna change the size here. So what I do, again, I'm gonna tell you, most pumps come with two choices, and that's tricky, right? Because one size doesn't fit all. Momcozy gives you several shapes and sizes, and they're a cushion. So sometimes I have women who the one piece doesn't fit them. We can even go and just get cushions that we can put into these shields here. I use a lot of lanolin cream, so you can put lanolin and lubricate the tunnel of the flange for when you're pumping. My point here being, we want to find something that fits you well and that is comfortable when you're pumping. I always size people when they're pregnant. Like we get that tool out, we measure, we make a really good guess of what flange we feel like is appropriate. I would never throw out all of your bits and pieces, store them because later, once the baby is here and when you're pumping more often, your breast will change as your breast milk comes in, and your nipples may change with more frequent breastfeeding and pumping. And then we may be changing size or cushion again. All right, so let's talk about some basic pump maintenance. I'm going to pop my book down here again. When it comes to pump maintenance, we want to keep the parts of your pump clean. Breast milk is really sturdy. It's very robust and resistant to bacteria and pathogens. We know this through research, but we still want to make sure we're just keeping things clean, especially if you're combo feeding and you're mixing breast milk and formula. But when you're pumping, you can take apart all of your parts and your tubing. Whatever pump you're using, your manual will let you know how to clean it. It is pretty common that if you have tubing, we don't want to get that wet. We want to keep it nice and dry. But usually for most pumps and pump parts, you can wash them with hot soapy water. You can run them in the top rack of your dishwasher. They make dishwashing baskets for all the little bits and pieces so you don't lose them. You can steam them. You can sterilize them. There's bags that go in your microwave now. There's sterilizers that go on your counter. Typically, when I'm working with a mom who has a brand new pump and you have, brand new bits and pieces, I'll grab more stuff here. What I'll do is I'll sterilize everything, like the plastic at first. I'll give it a really good deep clean. And then once I'm here, baby's here, and I'm breastfeeding and I'm pumping, I'll rinse it with hot soapy water and I'll wash it throughout the day, or I'll steam it at the end of the night. You don't need to be frequently sterilizing things if you have a healthy full-term baby. Washing and cleaning with hot soapy water is quite sufficient. But you want to keep everything nice and clean, keeping that tubing nice and dry. Now, down the line, you can keep an eye on your particular pump brand, and they make recommendations for how often you should be replacing the little bits and pieces, like the little valves inside, the little silicone pieces. If I have a mom whose pump was working really well, and now several months in it's not, and the suction isn't as strong, I'm going to first troubleshoot, is it a battery issue? Is it charging up well? Do the little bits and pieces actually need to be replaced? But just to make sure if it's something that we can quick and easy fix, that we can do that. So I'd like to talk about introducing a bottle because that makes sense to me when we're thinking about feeding our babies here. When it comes to getting all my props out again, I use my breastfeeding pillow even when I'm bottle feeding a baby. So if you're dabbling with pumping, if you're wearing a silicone milk collector, if you're using a manual pump, if you're collecting milk, maybe you're pumping once a day to just save a little bit of milk for going back to work or your partner, at some point you will likely want to introduce a bottle to your baby so they can learn how to bottle feed and breastfeed. So everyone wants to know when they should introduce a bottle. And this is a hot topic where you're going to read on social media and blogs and different advice from different people of like, do it at 2 weeks, 4 weeks, 2 months, 4 months, right? I like the AAP, the American Academy of Pediatrics recommendation, because it says that you can introduce a bottle after good breastfeeding has been established. I like that because it's flexible, right? So for me, I have 3 kids, and for my girls, they received a bottle in their first week of life. I felt I understood how to latch them. I could feel my milk coming in. And for me, I felt good, and I was like, I'm good to give them a little bit of a bottle. For some moms that I'm working with, they're like, I really like need the week or two to get good at breastfeeding, understanding how to latch my baby, listening for swallowing, and then they'll say, I'm feeling good. I feel like we're established, we're moving in the right direction. I want to introduce a bottle. Really at NAPS, our advice is, and this is from NAPS, it's not like a AAP recommendation. This is just from over 15 years of helping patients. If you haven't introduced a bottle by 4 weeks of age, I do recommend getting a bottle in the regular routine, because on the flip side, we work with a lot of babies that are 2 or 3 months old and parents are going back to work or they want to go to a wedding and their baby won't take a bottle. So I'm sure, as you can realize, in the parenting space, we're doing everything here in moderation and finding the right balance for you and your family. So, but let's back up and say you're expecting your baby or you have a newborn at home and you're thinking to yourself, when should I introduce a bottle? Perhaps 2 weeks out or 4 weeks out, you're thinking, like, I'm feeling good, breastfeeding's going well. I'd like my partner to give a bottle so that I can run an errand or I can sleep or just to share in responsibility. And so, what I'm thinking about of breast milk being established is that your milk is in, you understand how and when to feed your baby, and they're able to latch, suck, and swallow, right? We're all looking for like different things. I'd like you to not have pain. We talked about this last weekend. Pain is common, but it's not normal. You shouldn't have pain with feeding. Um, so again, there could be many reasons that you give a bottle right away. You might think to yourself, I'm not giving a bottle until my baby's a month old. And then your baby's born, and maybe they're born premature. Maybe they have low blood sugar, and we do need to introduce the bottle. Or maybe just things are going really well and you get, several weeks out and you're thinking, I'm going to do a bottle. Whenever you're ready to do it, I always teach paced bottle feeding. Okay. And so I want to explain this really quick, and I'll move my camera down. I have my Momcozy breastfeeding pillow here. I have my baby. When a baby is breastfeeding, they're laying down. They're used to eating laying down, right? And a breastfed baby, we talked about this a bit last week, they eat in ratios. They suck, suck, swallow, breathe, suck, suck, swallow. They take breaks. And when they're breastfeeding at the side, or if we do a recline feed where I sit back and I get cozy and they're coming up and over my breast, they're really able to control the flow of the breast milk from your breast, and they can eat at their own pace, right? And so a bottle, if we don't have a slow flow nipple, which really the only time you would find that is in the hospital, the disposable nipples they give you at the hospital are very fast. If I bottle feed a baby and I hold them upright and put the bottle in like this, they're going to go swallow, 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 swallow. And so if I'm able to keep my baby side lying on a pillow and bring the bottle in from the side, I'm starting to mimic breastfeeding, right? And it's a combination of the slow flow nipple, which all bottles on the market that are sold for newborns come with a slow flow nipple, right? So that's great. You don't usually have to worry about it when you get these newborn bottles. When you take your bottle apart and you remove the nipple, it's going to say on the side of the nipple, P for preemie, 1, 2, 3. So your newborn bottles usually come with an N for newborn or a 1 for, that's the first level. So usually you don't have to worry. It's usually on the bottle for you. And that nipple's slower, so they have to work a little harder to get the milk from the bottle. Keeping the bottle parallel to the ground, okay? So I have milk in the tip of the nipple, but I'm not dunking it. I have milk in the tip of the nipple parallel to the ground, is going to allow your baby to pace the feed in conjunction with the slow flow nipple. And should you want to hold your baby in a traditional position like this, you absolutely can. And you can still keep that bottle parallel to the ground. You also can lay them on their breastfeeding pillow, like they're breastfeeding, keep them cozy and you get comfy, and you can bring the bottle in from the side. Okay. You can even elevate them a little bit if they are working through some reflux. But that's what we do to help sort of like mimic breastfeeding, keep the playing field even. We often recommend a wide base nipple, although some babies do really well on narrow nipples. You can figure out what your baby likes. But for me, I really feel that this helps reduce what people worry about nipple confusion because we're keeping the playing field even. And where nipple confusion or struggles at the breast most commonly come from when I'm seeing patients is early on when breast milk is not in and well established. So my biggest example is mom is breastfeeding and maybe baby is really latching and sucking, but the milk is just delayed, it's not in yet. Or maybe we have a really lazy sleepy baby that's breastfeeding, so mom thinks that breastfeeding is going well, but it's actually a lazy sleepier feed, so the full milk supply isn't really coming in yet. Okay. And then the pediatrician says you need to supplement, so the mom is breastfeeding and then supplementing to keep the weight up with breast milk or formula, but we're not pumping. So, where lactation support comes in is we say to you, well, if your goal is to be breastfeeding and the baby isn't getting enough at your breast and you're supplementing, that's fine. That's good. We should do that. And we need to give you a pumping plan to tell your brain and your body, someone's still here, right? So I breastfeed, and I pump for the purpose of telling my brain, someone's still here that needs milk. I want you to circulate more oxytocin, more prolactin to increase milk so that as the milk rises in the breast and we're breastfeeding, we're needing less supplemental bottles. So, where nipple confusion often shows up for me is a baby that's breastfeeding and milk isn't in, or we're not working on pumping and boosting it, and they're breastfeeding and getting a bottle, and a week goes by, and now we go to breastfeed them, and they're shaking their head and they're frustrated because there's not a flow of milk from the breast. And a lot of women think, well, they like the bottle better. The bottle's easier. They want the bottle. The baby wants milk, right? And so for me, I'm like, what can we do to increase milk supply at the breast to keep them breastfeeding or getting them back to breastfeed? That is really a very common thing that I see. And so if we're working on a breastfeeding and pumping plan, we can get you back into the other, move you back in the direction of more breastfeeding and less supplementing if that's what you want to be doing. Okay, let's talk about some storage guidelines. Just the basics of breast milk storage guidelines and formula. I think it's important to talk about breast milk storage guidelines because we're here for a pumping class, and whether you're wearing a milk collector or doing manual pumping, or using your pump through, your electric pump or your Momcozy pump, you're going to be collecting breast milk in your collection container, and then you're going to decide what it is that you want to do with that milk. Right? So if you're planning on giving a bottle later that night, you can actually take the lid off of your milk collection and you can add it to the bottle and put it in the fridge later for your partner. Or you can put the cap on it. I have so many gadgets around me here. Get this open. Or maybe you say to yourself, I just pumped and I want to save this milk in the fridge. You can actually just use literally what you pumped into and just put the lid on it and just put this in the fridge. Or you can dump it in a storage collection bag and put it in the freezer and you can freeze it. Or quite frankly, if you just pumped and you're going to use it within the next 2 hours, you can even let it sit out. So when we're looking at storage guidelines, you are going to find varying guidelines on breast milk. A common one that you'll see, especially here in the United States, is the CDC's rule of fours. Hospitals often use that, meaning, and to help your brain mentally, breast milk is good for at room temperature for up to 4 hours. It's good in the fridge for up to 4 days. It's good in the freezer for 4 to 6 months. Okay. If you have a deep freezer, like one of those deep chest freezers, it can stay in a deep freezer for up to 12 months. All right. Once you defrost frozen breast milk and you take a frozen bag out and you melt it and defrost it, and that last ice crystal is gone, we recommend using it within 24 hours. Okay. So those are very specific guidelines. And I really adhere to those, especially for NICU babies or preterm babies. I do just want to comment that if you have a healthy full term baby, if you look at the latest research on breast milk and the studies, we need more research and studies on breast milk just in general. But if you look at what we do have in the latest research on breast milk, and Emily Oster publishes a lot about this if you're interested in reading more on that, what we know in research is breast milk is incredibly sturdy and robust and resistant to bacteria and pathogens. Quite frankly, we probably can give it more credit than we do. So I that's where some real life parenting advice comes in, and you can weigh your own personal risk tolerance. But breast milk that sat out for a little more at 4 hours at room temperature, what we know through research, probably fine to now put in the fridge. It's been in the fridge for 4 days and you forgot to freeze it. I'm not going to throw it out. I'm going to freeze it, right? When you defrost frozen breast milk, and you are wondering if it's still good, it's been in the freezer for a while, you will know when your breast milk is starting to go bad because it's going to lose its flavor and its taste. So, a common scenario for parents is that they'll defrost a bag of frozen breast milk, they'll make their baby a bottle, and they'll go to feed their baby the bottle of breast milk, and their baby will not eat it. And you're like, why won't they eat it? Right? So, parents, they take the bottle and they smell it and they're like, oh, God, that smells funky. And if you taste it, you're like, oh, it tastes terrible, right? It's not usually bad that it's going to harm them. It has lost its flavor and its taste, and they won't eat it. That being said, when we're thinking about things that are sitting out, right? The thought here is that the longer that things sit and they get yucky, we don't want them to grow bacteria and pathogens to make babies sick. And so, yes, we know through research that breast milk is really, really strong and robust. In fact, in one study, it left breast milk sitting out for days at extreme temperatures. And when they looked at it again after that, it hadn't changed in load of bacteria or pathogens. But once you defrost frozen breast milk, we do say to use it within 24 hours because I feel like that milk that sits out and out, it just starts to get yucky and lose its flavor and taste. So you can look at breast milk, you can do your more research on it. You can use your rule of fours just because I do think that's easy on the brain, 444. And by the way, breast milk is not considered defrosted until the last ice crystal is gone in the bag. So I'm sure we have like 300 and we have 360 people here right now. I'm sure one of you has come down in the morning and the freezer was ajar, or somebody left it open all night. And you're like, oh my God, the breast milk's in there and now it's defrosting and we have to throw it all out. If there's chunky ice or ice crystals in that bag, you shut the freezer. Okay. It's not considered defrosted until every ice crystal is gone. Now, when it comes to formula, and it's important to talk about formula here at the pumping workshop, right? Because some of you are pumping because you're triple feeding. You're breastfeeding, you're pumping, and you're bottle feeding for weight gain, perhaps, or to bring your milk in. Some of you might be combo feeding because you're back at work and you're navigating supply. Formula, we are going to really adhere to the guidelines because it's powdered and it's processed and it doesn't share the same components of breast milk with the natural antibodies and the resistance against bacteria. So when you can look at your formula and the side of the can, but once you've opened a can, it's usually good for the month. Once you've opened that powdered formula, you can batch prepare formula. So if you are mixing breast milk and formula or you're using a good amount of bottles throughout the day, you can actually mix a batch of formula and you can put it in the fridge, like a pitcher of lemonade, and then it's good for 24 hours. And then you can actually, like add to it throughout the day. If you prepare formula, it can stay at room temperature for up to 2 hours. And then once you've started feeding your baby a bottle of formula, because their mouth has touched the nipple and there's formula in here, we worry that bacteria could grow. So we want you to use it within an hour. All right. Now, breast milk is really robust, as I said. If you're mixing it with formula, I adhere to the formula guidelines. There are really cool products now on the market, though, so you can keep your breast milk cold. And so, for example, like I like the Momcozy cooler, and I'm just going to show you. Let's say I'm like going out for the day, or I'm at the beach this summer, and I want to go to the beach all day. I don't actually necessarily want to warm up all my breast milk and make bottles and bring them if I'm not going to use them. Because if I keep my breast milk cold, I can keep it around for a little bit longer. So if you are like traveling for the day or going out for the day, or maybe you're back at work pumping and you want to keep things cold all day while you're pumping and then bring it home and freeze it, things like this are super cool, right? Because now I can have my thermos, I can have my ice pack, you can keep these cold. And if I pump when I'm back at work, I can add it into my collection bottle all day long while I'm pumping. Or I can make my bottles and head to the beach for the day and keep them cold. Okay. So at the end of the day, if I get home from the beach and I haven't used all the milk, it's still cold. I can put it in the fridge or I can freeze it. Or when I get home from work at the end of the day and I've pumped all this milk, I can now either bag it up and freeze it, or I can dump it into bottles for the next day at daycare. So I do think having obviously a great pump and a pumping bag to get your things to and from work, and some kind of cooler, because you're going to use this when you're back at work and you're pumping, or when you're on the go, or even with traveling, like if you're flying somewhere and you're going to be bringing breast milk to and from with you. All right. So I always want to like talk in our classes about how your partner can support you. For me, I've been in the education space for a long time now, and it's common to find classes, prenatal or postpartum, that really focus on mom and baby, and only speak to mom and baby. And when you're expecting a baby and bringing a baby home, you need a lot of help. And you need your partner and your family and your friends to be supporting you, like the village, right? And sometimes partners that I'm working with feel really helpless, especially if the mom is doing a lot of breastfeeding and pumping, because they're unsure like how they can tag team and jump in and help. And so it, quite frankly, as a breastfeeding mom who's breastfed 3 times, the first 4 weeks of life can feel like a lot. And you can tell me if you agree in the chat. If you're home with a baby postpartum, you're recovering from childbirth, you are taking care of a tiny human that eats frequently. We talked about this in last week's breastfeeding webinar. They're eating on demand, but really like every 2 to 3 hours. And so it can feel like if you're breastfeeding and you're helping your baby fall asleep and you're trying to take care of yourself, you're trying to sleep and eat when you can. And so days can feel really long when you're postpartum, but they are going by very quickly. So if your partner is here with you listening in, like, thank you for being here. If they're not here, let's give them a couple ideas for how they can help you, because a lot of times they do really want to help and they're just not sure what they can be doing. So, if you're breastfeeding exclusively and you're up at night feeding, you be in charge of feeding, breastfeed your baby, okay? Offer both sides while your partner's sleeping right next to you. And then when you're done, pass the baby over to your partner. They can do the diaper, they can swaddle the baby, they can do the soothing and help that baby fall back to sleep so you can drink some water and fall back to sleep yourself. I teach every partner in all of my prenatal telehealth visits and when I come into the home how to set pumps up, how to put them together. I'm like, this is a flange, okay? This is a pump part. Like, I literally show them how to assemble the pump, so that if you're saying, maybe you're triple feeding and you say to your partner, like, after I breastfeed, I'm gonna have to pump for 10 minutes. They can be like, great. And they're in the kitchen and they're putting everything together for you and bringing it to you when you pump. I also teach partners about storage guidelines, with which we just talked about, so that when you're done pumping, they can walk over and take the milk and they can bring it over to the fridge and add it to a bottle. They can bring it and put it in the fridge. They can bag it and date it and write how many ounces is on it and freeze it for you. How to defrost breast milk and prepare bottles. All of these things sound really small, but they're incredibly helpful. Diapering, swaddling, washing pump parts, setting up pumps, cleaning bottles at the end of the night before you go to bed. Maybe their job is that the sink is full all day long of bottles and pump parts and pacifiers. And every night before bed, their job is to load that top racket of the dishwasher and run everything so that in the morning when you come down, everything's clean and ready to go. I love talking about tag teaming. Even if you're breastfeeding, like, everyone is tired when you bring a baby home and you have fragmented sleep. You're feeding, breastfeeding, or pumping, bottle feeding like every 2 to 3 hours. By the time you diaper that baby, by the time you swaddle and soothe them, time has gone by and everyone's really tired. So as we get further out and you feel good about your breastfeeding journey and you do want to explore pumping and ways to give a bottle, there's really cool examples of how you and your partner can decide what feels good for your family, of like how you maybe want to tag team. So let's use an example of splitting up the night. Sometimes I have a mom, and what she'll do is she'll breastfeed, pump, and go to bed, and our partner is in another room or a living room with the baby. And the next time that baby's up, they feed the baby a bottle of breast milk that the mom has pumped while the mom is sleeping. Okay. To be clear, this is an active choice where this mom is saying, I'm skipping a feed, I'm choosing sleep. Everything in parenting is weighing risk, benefit, pros, and cons. And so, yes, there is benefit to breastfeeding and pumping, and there's benefit to sleep. Quite frankly, you synthesize prolactin when you're sleeping, so there could be benefit for your supply to actually get sleep. Sleep is so important for mental health. We have so much research on how sleep can fix symptoms of mood disorders, perinatal mood disorders, anxiety, and depression. And so it might be an active choice that one night, if you're really struggling with anxiety or your recovery, that you say, I'm going to have my partner give a bottle and I'm going to sleep. And then the next time your baby is up, you're going to pick the baby up and breastfeed, and your partner is now going to sleep. Some women will tackle breastfeeding all night long, and they'll tell their partner at 5 or 6 in the morning, I want you to come in and take the baby, and just take the baby out to the living room and be with the baby so I can stay in bed and I can sleep in. Right? So there's so many different examples and ways to do it. I think my takeaway here for you is, if you're struggling with breastfeeding, picking out a pump, sizing your flange, or you have pain with pumping, or you're postpartum and you're struggling with supply or navigating how and when to pump, or how and when your partner can give a bottle, like, these are things that we can help you, where we'll ask you and your family like exactly what's going on with you, what's going on with your supply, what's going on with your pumping journey and your bottle feeding journey, and like, what do you need for your physical recovery, so that we can make a plan that's really good for you and your family. So I want to come out perfect on timing and do as many questions as I can. But I imagine that there is a lot of questions, and they're probably all really good. And I want to make sure that you can ask them to me. So Nurture by Naps is our Instagram handle. Our company is Naps. We have an online membership platform. When you log into our online membership platform, which you'll find when you scan the QR code here, when you log into Nurture, our membership, we have an Ask a Nurse board, and you can post a question anytime on this board, and a real registered nurse or nurse practitioner, it's not a bot, we will actually read it and we will answer you within 24 hours. I invite you to use the Ask a Nurse board after the webinar today or sometime this weekend to ask a question. We have a ton of webinars that are coming up. So if you join for the next month, you can just jump into another live webinar. We have new mom support groups, and we have live meetups throughout the week. So I'm going to answer as many questions right now as I can. But if you don't get your question answered, or you just want to know more and you want more support, I invite you to use the code 30 for 30. So if you scan that QR code, it takes you to our membership page. You can choose the monthly membership option and put in 30 for 30 at checkout, and come in for the month and like use the board. There's so many cool videos and courses inside of Nurture. There's just a lot that I can give you. If you also visit our website and look at our lactation page, we do accept a lot of major insurance companies, so that you could probably set up a pumping consultation with us if you're pregnant or postpartum, to just like also learn more about the topics that we talked about today, and it potentially will be covered through your insurance. Okay, so now here's what we're gonna do. I'm gonna come out to the chat, and thank you. You all are saying like really nice things to me in the chat. So thank you. I'm so happy that you enjoyed this, that you thought it was helpful. I'm gonna answer as many questions as I can. And I'm gonna try to just pick different and random ones. And then we're gonna do our giveaway. So stay until the end, because we're giving away really like a really amazing pump, which is very cool. Okay. So let me scroll back. Da, 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 da. Okay. There's so many. Sorry, I'm going up to the top. Okay, here we go. I'm just going to grab a random one. Can we mix the pumped milk expressed at different times throughout the day in a single large bottle? I love this question. Yes, you can. It is a myth. It is not based on research that you like can't mix warm milk with cold milk, or different times of day. And I know you'll see that on like TikTok, your AM milk, your PM milk. All breast milk is good milk, and you can add milk throughout the day to a jar. So if I'm back at work and I'm using my Momcozy cooler, this is a great example of these bottles in here. When I stop in my workday and I pump 3 times, when I'm done pumping, I'm coming over to this bottle and I'm dumping in what I pumped, and I'm dropping it in my cooler, and I'm moving on with my day. And the next time I pump in my workday, I'm going to add to that same bottle. So another way that I see women doing this is if you're wearing a silicone milk collector. So let's say you're breastfeeding your baby and you're wearing a silicone milk collector on the other side and you're just collecting letdown while nursing, you can then walk over to the fridge and you can add that milk to a bottle throughout the day. And quite frankly, you might like get barely half an ounce every time you breastfeed, but all day long, if you add that to a bottle, you might have 2 ounces by bedtime for your partner to give a bottle. So yes, you can do that. Okay. How do you know when you don't have any breast milk left? I would like to pump after breastfeeding to increase my milk production. First time mom. You also said, sorry, Mallory, and you don't need to apologize. That's a wonderful question. So if you're breastfeeding, in theory, there's always milk in your breast all the time. That being said, when your baby latches and sucks and swallows, they are draining that flow, that forefront of the milk. They're grabbing all that really fullness that's there. And when they're done and you burp them and you take a break, your body has a rest and a reset. And it's like, it's supply and demand. Your brain's like, let's refill again and be ready for the next feed. Okay. So while there is always breast milk left behind, your baby would be frustrated if you breastfed and then waited an hour or two and pumped, and then they want to eat again, you go to the breast. It's not going to be that flow that they love. So when you're breastfeeding, Mallory, and you want to pump to save milk or to increase supply, what I'd like you to do is feel your breast before you feed. Latch your baby. Get my Momcozy pillow here just for extra support. I'm gonna feel my breast. I'm gonna latch my baby. This is for anybody breastfeeding. How do I know what they're getting? How do I know they're getting enough? And now that my baby is latched and they're sucking and swallowing, I'm gonna lean in and listen. Do I hear swallowing? That is a sign that your baby's eating. Swallowing, swallowing, swallowing. Towards the end of the feed, you might feel sucking, but if you don't hear swallowing anymore, they're not eating, they're self-soothing. Okay? So not all babies will pop off milk drunk. So maybe 10 or 15 or 20 minutes in, you're like, they're not really swallowing anymore. And my breast feels softer. And they're peeing and they're pooping and they're gaining weight every time you see the pediatrician. That's how you know it's like the system is working. So if you've offered the breast and you've offered both sides for whatever amount of time, 5, 10, 15 minutes, and now you don't hear swallowing, and you would like to pump to increase milk supply, once you've offered both sides and you feel a little bit softer, go ahead, put your pump on, 5, 10, 15 minutes, whatever you're capable of, and pump. And now for the purpose of increasing milk supply, you may not see any milk come out when you pump, but that's okay. You're just telling your brain, someone's still here. Someone's still here eating. I need you to increase supply because I'm increasing demand. And so for triple feeding, where we're pumping after breastfeeding, that is not a sustainable long-term plan because it's rigorous, but I'll have women do it for like 3 days. And 3 days later, they usually tell me, I feel fuller. I hear more swallowing, right? I don't need to supplement anymore. Like they can feel a boost in their supply. And you don't have to do it after every feed. Some women feel like their supply is low at one point of the day, like one time of the day. So they may just say like, I'm going to always pump after my 4 o'clock breastfeeding session to just for like 3 to 5 days to see if I can increase my milk supply. All right, let's see. You guys are all supporting each other very nicely in the chat too. So thank you for that. I'm skimming through your chit chats, which is really nice. A lot of people are asking if I recommend a bottle. Quite frankly, I don't like have this like one favorite bottle that I love. I do just try to pick a bottle that has for my breastfeeding, has a wide neck and a slow flow nipple, which is a lot of bottles. One thing that I think about is like pieces and cleaning. I have 3 kids. I don't like a lot of gadgets and things to clean. So things that are simple setups, I think, are easier as well. Every now and then, as a lactation consultant, I will change bottles if I have a baby struggling to take a bottle because maybe they have oral restrictions or they're really good at breastfeeding and they never learned how to take a bottle. So there's like pigeon nipple bottles, pigeon shaped nipples. There's the man makes like a flat wide base nipple. So sometimes I'll change a bottle based on like an oral assessment. And when I visually see breastfeeding and bottle feeding, I might change the nipple then. But just to get started, I would ask your friends or your family what their bottle was that they liked and why they liked it. And I usually recommend just picking one bottle and sticking with it. Changing bottles to like try to figure out what your baby likes, I think can be a bit confusing. Let's see. La 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 la. Thank you for all the nice comments. A few people have asked about the recording from last week. That is coming still. There was a glitch when Momcozy was editing it, but it is fixed now, so we will be able to get that recording to you, and you will also be getting this recording as well. Here's a question. I breastfeed and bottle feed. Do I need to warm the bottle or can I offer cold breast milk? Great question, Ashton. You do not have to warm breast milk. You don't have to. You can give your baby a cold bottle. You can do cold breast milk, cold formula. You can mix breast milk and formula. It can be cool. And if your baby will happily take that bottle, great. It's one less step for you. Now, some babies prefer a warm bottle. And if that's the case, if they're being weird with a bottle or they're struggling to take a bottle or they're not finishing their bottle, but they're doing really well with breastfeeding, a tip is warming it up. And so I'm sure you're all noticing all babies have a different personality and preferences here. There are just going to be some babies that do generally prefer a room temperature warm bottle. And so if that's the case, then that's fine. Like you can warm their bottle. I know it's one more step, but that's okay. But it's not like mean or bad to give your baby a cold bottle if they'll drink it. Somebody asked about the refrigerator method. This is a great question. And I think I know what you mean. And that is that, let me grab some of my pump stuff again down here. The refrigerator method is when you're pumping. So there's a lot of pieces, right? Your pump parts. I'm going to slide mine back together, my flange, my bottle here. When you're pumping all day long or a lot of times, and you have all your like pump bottles and gadgets, instead of taking everything apart and washing it rigorously between pumps, women will take all of the pump parts, everything, bits, pieces, flanges. They'll store their breast milk in a bag or in their bottle, and then they'll reassemble their pump parts with the milk on it without washing it, and they'll put it in the fridge. And the thought here is that it's just breast milk, and breast milk can stay in the fridge for 4 days. So if you're pumping multiple times throughout the day, instead of taking everything apart and cleaning it, you can like dump your breast milk out, store it, reassemble everything, and put it in like a giant Ziploc bag. Put it into the refrigerator so the next time you go to pump, it's already set up and ready for you to use. All right, I know we're running out of time and we need to do our giveaway. Let me just come out here. And so again, these are incredible questions, and I know that there's more. Please, please check out Nurture by Naps. You have the membership for a whole month for just $30, and you can talk to me this afternoon on the Ask a Nurse board, ask me questions, and just check our lactation page. You're probably in, a lot of you are probably in network, and you can set up a free lactation call to like dive in more on these questions. But for now, let's get you this giveaway. It's amazing. This is actually my favorite hands-free pump. I'm not saying that because Momcozy asked me to come today. This truly is generally, like, I've pumped 3 times. This is my favorite pump. It is quiet, it's easy to use, and it has a really great suction.
Thank you so much, Emily. Great call, great questions. Thank you guys so much. It's time for the giveaway. I will select 3 names at random, and you have to say that you are here in the chat to qualify. If you do hear your name, type here, and you'll also see the email mcp@momcozy.com. And we just need your first, last name, address, and phone number. So let's get started. Who will be the first?
Showing you how nice and easy this amazing pump is. Clicking it right together, right in the bra.
The first person, do we have Ashton Brockwell here?
So two of them.
Ashton Brockwell, you're here.
Yay!
Yes. The next person, do we have Annalise Rodriguez? Annalise, are you here? Yay. Okay, our third person. I'm excited. Who will it be? Do we have Tatiana Edwards? Tatiana Edwards, you're here. Okay, all three winners. Thank you so much. Please make sure that you send that email to mcp@momcozy.com and join us again here next week on next Friday for our call at 1 o'clock. And we can't wait to see you there. Have a great weekend.
Thanks,
Thank you so much.
everyone.
Thank
Have
you
a
for
great
joining us.
day. Happy Friday.
Happy Friday and have a
Thanks
great
for being
weekend.
here. Bye, everyone.
Bye.